Hi, I'm Sarah Zeidler, the Executive Director for UnityPoint Health, John Stoddard Cancer Center, and I'm here today with Dr. Andrew Nish, the Cancer Center's Medical Director. Thank you so much for sitting down with me today.
Great to be here. Thank you.
We're excited to talk about the Cancer Center and what we pride ourselves in and what we think makes it a great experience for patients. Can you tell me a little bit about what you hope patients feel when they walk through the doors of Stoddard?
You know, it's sort of interesting. We build these institutions, but I want them to feel calm and relaxed. That yes, this is a place that I'm going to be cared for. You think of walking into a beautiful natural setting and you feel more relaxed and you feel calm, and that's sort of what the first impression should be, is like, oh, I'm calm, I know they're going to take great care of me.
Yeah, very good. Yes, I think we also know that's important for patients and their families as well. We pride ourselves in taking care of the whole person and the whole family. So what do you think whole person care means to you?
Oh, when we think of care in the medical world, it's like, okay, how are we going to treat this disease? But it goes so far beyond that. It's how do we care for the person's mental health? How do we care for their family? The family is part of this journey. It's just more than a patient. How do we care for their children? How do we care for their spouse? How do we care for their overall being, okay? Because we can have people who are anxious and terrified, but we can change that. And so I want people to understand that we want you to feel cared for so that you can heal and be well at the end of this journey.
Yeah, because cancer just doesn't impact your physical health. It impacts every aspect of your life.
Your social health, your relationship health. A lot of cancers result in changes in sexual function or changes in intimacy, and that can be very impactful on marriages. And then there's the impact of the financial consequences of this. So we want people to be assured that we have a team of people who will work with their financial aspects so that we can take some of that off their plate.
Yeah. So in your role as medical director, how do you see whole person care show up every day here at the Cancer Center?
It starts the minute someone walks in our door. How do they feel when they're greeted at our entrance? And then it just snowballs from there, because they're going to interact with literally dozens of people, right? We have navigators, we have social workers, we have financial navigators, we have dietitians, we have our Empower boutique. And then we have the caregivers themselves, the nurses, the technicians, the doctors. And so I want everybody, when they interact with a person, to feel heard, understood, and that person is there for them at that given moment.
Yeah. What I'm hearing you say is that so much of it depends on the person and the people that make up the Cancer Center.
It does.
We can only do so much with facilities and the treatment, but it's all about the people that are impacting and that personal touch, that high touch that we can provide here.
And there's so much literature, not necessarily in how people feel when they interact with a nurse, but when you look at how, let's just use medications are administered. If medications are administered in a compassionate, thoughtful, caring, informed way, they benefit the patient very differently than if someone just comes in and says, here's your medication, boom, gone. So there's something about the human interaction. There's something about how people actually feel when they interact with a person. And that feeling goes a long way towards healing.
Yes, definitely. It's crazy how all those pieces come together and all the things that can impact someone's outcomes beyond the science.
But there is science.
Yeah.
We know that.
That's true.
And why, it's just interesting how we tier positions in our cancer center or any center. We have our receptionists that are lower tiered, but they're maybe the most important person in the entire center, because that's your first interaction. And but I want everyone to feel welcome. I want everyone to feel heard, and I want everyone to feel that they are well cared for. And if they're not, and they don't feel that way, then we have a problem.
Yes.
And we can fix it.
Exactly.
That's the beauty.
Yeah. Can you speak a little bit about the programs and resources that we have here at Stoddard that make really an exceptional experience for our patients?
Yeah, how long is this video? No, we'll start with our group of ancillary care services. Our navigators, our nurse navigators are just wonderful people who will help people understand their diagnosis, understand what's going to happen, and just be there as not just a resource, but an emotional resource. Mm-hmm. And then we have our psychosocial people who are licensed mental health counselors. They're great with mental health counseling. They will also work in the social work aspect. How do we hook them up with different areas in the community to help with their journey? We have our dietitian who can help with how do we eat? What nourishment do I need? And our financial navigator, and she is, you might think, well, financial navigator, why do we need that? We need it more and more. Health insurance is changing, copays are increasing, and cancer can be devastating on finances, so hugely important part of our care team. And then, all the people behind the scenes, our administrators, our registrars, mm-hmm. our community outreach person. These are all key that patients may never see, but they're really important in how this center functions. And then we have, our whole research arm, right? Mm-hmm. We really encourage research trials, getting people into trials so we can understand what works and what doesn't over time. And they're really great people too. And a lot of times patients won't meet them, but when they do, I think they impart this sense of, we're here to help you. Yeah. Mm-hmm. So we have this great team, and we're finally able to utilize those to the max.
There are so many disciplines involved in cancer care and that are here at the Cancer Center. I think that allows us to really cater the experience to the individual patient, because no two patients have the exact same experience with their cancer.
Right, and it's no cancer is the same. There's thousands of different types of cancer, and the way we treat patients is very different now. And we don't have this cookie cutter formula, mm-hmm. right? So a 35-year-old comes in, well, they need help with children. They need help with their education. The 65-year-old doesn't. Completely different needs, yet we can meet everyone's needs with the team that we have.
Right, and cater their experience to what their goals are.
Right.
It's very important.
And goals are important. Motivations are important. Goals are important. And so that's why talking to people is so important. We want to find out what they really want in life.
And that personal aspect.
And help give it to them if we can.
All right, my final question for you. What makes you proud to be part of the team here at Stoddard?
Oh, gosh. Well, as you know, I've been here 34 years. Mm-hmm. You don't stay at one institution unless you have some pride in that institution. And it's the group of people I work with. There's no question about that. It's sort of interesting as I look back. I was with a patient yesterday, and she said something about my schedule, and I said, I don't know, Stephanie runs my schedule. And then I realized, as Stephanie pointed out, all of the people I work with are women. Women run my life. But it's a cool thing, right? And I just enjoy working with everyone. And women bring such a different feel to an institution because they're more empathetic, they're more well organized, and it's truly a privilege to be able to work with really an extraordinary group of people here. So that's why I stay, that's why I do what I do. And then, working with patients in my integrative oncology clinic is another reason that we have some extraordinary findings for people, and really the level of appreciation of what they can do for themselves is very gratifying.
Oh. Well, I think we have a very special team here, and we're really glad that you're part of it.
Thanks.
So thank you so much for sitting down with me today.
Of course, my pleasure.